everybody, and thank you for joining us once again. Apologies for the earlier break in transmission, technology, and all whatnot. And we are thankful that you can rejoin us again. And today we are going to be having a conversation. This is the second episode of the Career Showcase by the Digital Health Skills for Africa, which is a non-profit that is poised with a mission to build a digitally enabled workforce for Africa. So we have a lot of programs, and this is one of the programs that we have, where we sit down with digital health experts across the continent and ask them how and why did you get into this career path? Because we know that there's no linear pathway. There's no clear-cut pathway into digital health in Africa. And so this is how we can find out the shortcuts, how to get into this pathway. They've started the course and it's up to us to find out how they've done it. So without a waste of time, my name is Izine Onwekwe. I'm the Executive Director of Digital Health Skills for Africa, DHSA. And with me today is Mr. Caesar. I'm going to allow him to introduce himself. Over to you, Mr. Caesar.
Yeah, thank you very much. And I'm sorry to all the viewers for the hitches. I think we are about to have a conversation on digital health, and these are practical lessons for all of us. But my name is Caesar Kaba Kobosra. I'm a Ghanaian. I work with Young Experts Tech for Health, hosted at Transform Health, and supporting some conversation around digital transformation for health so that we can all use it for universal health coverage. I'm sure along the line of the conversation, you'll get to know me a little better. So let me just leave it here.
Okay. Thank you so much. And thank you for joining us today. So we're going to just start real chill. This is a very informal conversation. So it's not an interview. So can you share your career journey with us and how you got into this digital health space?
Yeah, and I hope you can hear me because it just started raining at my end.
Yes.
But if you can hear me, let me just proceed. I think life has so many ways of leading us to what we really want to do. And just to disclose that I have a nursing background. I hold a BSc nursing degree from the University of Ghana. But whilst learning and being in nursing training to be a nurse, I kind of found out that the clinical practice was not very favorable for me. I felt that I was not as strong and tough as the clinicians are to deal with all of these issues. So I decided to explore public health from the reproductive health point of view, where I engage with civil society organizations in Ghana in attempts to ensure that reproductive health education is more accessible to young people in Ghana. So we did that through rural education. We engaged policymakers, and we set up systems and platforms to try and do that. But whilst doing that, I kind of just I saw myself rising through the ranks in my organization. Then the Planned Parenthood Association of Ghana, becoming a programs coordinator and leading the youth wing of the organization. Um, I think that was a really important moment for me because when I got to lead that youth programs point of contact for the organization, COVID came in. And if you remember what COVID 19 did to all of us, at a point we could not go on the ground. So we could not go to the communities to do health education. We could not go and meet policymakers. Young people were left with our information. And in Ghana, we had a rise in teenage pregnancies because students were at home and a lot of things happened. And so, as the youth programs lead, I kind of began to explore what opportunities exist so that we could reach out to young people and provide the education that we did through digital platforms. So we secured a grant then from Global Affairs Canada to set up what is currently operational and is called the Yankasa Contact Center. So Yankasa is like Let's Talk. So we branded it Let's Talk because it was a crisis moment and people were looking for places to go and people to talk to about their challenges. So that's where my digital health career began because I kind of led the setup of that platform. It's a call center, it has a Facebook, Twitter, and other WhatsApp, and other platforms where contact center agents who we have hired are seated and ready to respond to the challenges of young people. So based on that experience, I realized how crucial digital health is in the African context. Because before then, the digital transformation was seen as a privilege. So you couldn't see a lot of people discussing it, but it was about the privilege people have in digital platforms and using them. So when I had that opportunity, I took it upon myself and led to my engagement with Yet for Age, and Yet for Age is Young Experts Tech for Health. I volunteered with them to learn more about digital health, and now found myself becoming the coordinator of Yet for Age and transitioning into mainstream digital health practice. So basically, that's my path from clinical experience, deciding to be a public health practitioner, and seeing digital health as an opportunity to do my work better. Yeah.
You know, you and I kind of have a similar pathway. I am a pharmacist by training, and went into public health. And COVID also opened the pathways for digital health for me. So COVID was a pivotal moment for me as well to get into digital health proper. So our stories are very similar. And you talked about Yes for Health, for H, which is the Young Experts Tech for Health. Can you tell us about the organization and what you do for them?
Yeah, so Young Express Tech for Health is a youth-led initiative that was set up to ensure that young people have space to influence the digital transformation for health, so that youth voices are more present in policy conversations and we can better influence the processes so that we can reap the benefits of digital health. When I joined, I was a member, and it had young people from all the WHO regions represented so that we can ensure we have diverse voices to influence the processes. And then I became a coordinator. Coordinatorship is just about ensuring that you identify platforms that youth voices are required for digital health, and ensuring that you create space for young people to come through and provide their perspective. Today, I think the organization has shifted a little and merged with, and so I now serve as a youth policy officer in charge of youth. And so, still doing the same thing of creating space for young people so that we can have youth voices present in the conversation. Yeah.
Awesome. That's really great having the young voices, because most times the conversation is had in boardrooms. You have much older people having these conversations. Young people are not involved. But the interesting thing is that it's the young people who are coming up with ideas. We are the ones who are hungry to bring digital health innovations and initiatives and startups, and we're not part of these conversations. And that's why sometimes we start things and they are not um, ingrained into the system. They are not. It's not like they are progressing. We start things and then they die off. So it's important that we are part of these conversations from the beginning, and that's amazing work you're doing. Thank you very much for that. So one thing I want to find out is, in this as you're growing in your career or progressing in your career in digital health, what are the key skills that have been most valuable to you, and how did you develop them?
Yeah, thank you. I think, yeah, forget my clinical background like me, but forget that. Let's put it aside. I after entering into the space, I've realized that basically nothing like digital health, if you ask me now, because it's health, it's programming. Become more digital like the world has been. And so It's the same health programming we used to do. And the world now becoming more digital, we need to do it on digital platforms. So it's not too scary to enter that conversation. And I usually say that digital health has um, a way of framing that gives the tech-based people upper hand. So the original phase, the beginning phase of digital health, the tech-based professionals who developed apps, who were computer literate, and who could create platforms had a really big upper hand to enter into this. You enter the space right now, you realize that. And then came the health practitioners. So if you had the health background and you wanted to venture into digital health, then it also became easier because you do not, maybe you don't have the tech-based skills, but you have the health knowledge that the tech-based people need. And so they bring you on board so that both of you can try and make things happen. But I have realized that digital health also has a social element that people need to learn. The social element being that when the tech people meet and develop their apps, and they develop it so that they are used by the health practitioners, those apps are irrelevant until they are desirable by the population. So if the population doesn't find this platform developed exciting and easy to use, they are not coming on it and it's not going to be really relevant. It will die off. And so there's a really big gap in the social element of digital health where we need people who can create space for conversations among the end users of digital health platforms. So if you are somebody who has that convening skill, if you have that skill of moderation, if you have that skill of connecting with young people, then you are relevant in this space where you can pretty much bring the tech perspective, bring the digital or the health skills on board, and try to now find solutions that are desirable by the population. And beyond the end users, even the health practitioners also need this social skill. So I feel it's very important because if you can also enter the the health professional space and help them understand that they need certain kinds of applications to be more effective. And so I give an example. There's a platform called DHA, DHIS2. I think it's a
DHIS2.
tool,
Yeah,
yeah.
yeah.
It's a platform for monitoring and evaluation, right?
It's for
It
a
is
lot of
everywhere.
things. Yeah, yeah.
Yeah, for a lot of things. But it's everywhere. But if you take time to talk to health professionals about how they are using it, you'll get different stories. So
Exactly.
many of them are struggling. So many of the health professionals are struggling. And then the digital health or the tech people designed it. The digital health practitioners are using it, but they have problems that they are not able to come together to solve. And so the platform is lacking behind. I've gone from Ghana through to Tanzania to even Nigeria. I have realized that all most of the health professionals that I have met and asked about that platform, they are struggling. And so again, we need that mobilization, facilitation, and social skill in there to bring these people together to find a way of adapting the platform and make it more desirable for the professional. So you also need that skill. Again, there's another element of digital health, which is the policy political angle that we need to create an enabling environment that allows the tech solutions and then the health professionals to thrive. An example is that a lot of curricula in the African continent is still not tech based, but we are training health professionals who are using tech platforms to solve problems. So when they do graduate and enter the space, they struggle. They struggle because the platform DHIS2 that I just mentioned is a tech-based platform. If you can't maneuver a computer, you cannot use it. But you are not taught to maneuver the computer in school until you are done. So there's also that policy, political angle that we need to create so that policymakers can better understand and move it. So if you have that policy engagement skill, you can thrive in the digital health space. You don't need to be a digital health practitioner to do so. There's also the financing bit. So the tech solutions are coming up, but a lot of them die off because we don't see them come to scale. They are not scaling them up. There's limited funding in the African context to do so. So if you are somebody who can find money, if you are able to find resources for Ezine and all of her colleagues who have digital solutions and platforms, you can enter the space and you can finance these solutions, you can finance conversations, or you can even mobilize resources. You may not have the money yourself, but you are good at writing proposals and helping people find resources to do so. So you can enter the space. There are also another category of professionals who are doing monitoring and evaluation. If you adapt very well to understand how to better monitor the effectiveness of digital health platforms, you can be in the space. So I can go on and on and on about the skills that are needed, but I just wanted to make a point that digital health is health. And so anything that is relevant in health programming can be migrated to the digital health sphere and we can do it better. Yeah.
I get the point of these are all transferable skills. All you have to do is just
Yeah.
practice them within the digital health space. And
Yeah.
if you are listening, I just want to call out the things you talked about: coordination, social skills. If you can bring people together, that's an amazing skill to have. And that's just programming, really. That's project management. And also policy engagement. If you're good at that, I am someone who has been I talk loudly about this thing about curriculum because it doesn't make sense. We are talking about digital health, digital health, digital health. Yet we've been teaching people the same thing they taught us 50 years ago. So when they come out, they'll now start learning. Yet we want them to do DHIS to want them to be building systems. We're talking about AI. Yet what they're learning in schools is how to dissect cockroach, how to draw toad, how to draw. That's what we're learning in schools. I mean, so it's very appalling. That conversation is something that we need to be having, and not just having, but actually doing something about it. There's a paper I'm trying to write. If anybody's interested in writing a paper on this with me, please, by all means, slide into my DM on any platform. I'm ready to collaborate with you on this paper, a policy paper on this. And then financing as well. If you have skills in grant writing, proposal writing, that's something you can market yourself in. Because these people need money, they need financing, so that's amazing as well. And then M&E is a numbers game, so if you can be able to track what you're doing in your implementation, definitely you'll be very, that's a resourceful skill to have. That's amazing. Thank you so much. And this has covered a lot of things for me. And there's something I want to call out as well. You talked about a lot of things, clinicians, technologists, policymakers. So this sort of shows there's that um triangle. That's that 3 points between the technologists, those who do the tech, the clinical people, and then you have the policymaker somewhere. You are someone who is in policy. You've been in clinical settings, you use technology. So how do you think we can foster collaboration between these three people to make sure that we have um, systems that are sustainable?
Yeah, thank you very much. I think, first of all, I think there's something that is very clear on, like you said, my engagement with policymakers and also with clinicians and also with the end users. I think all of that triangle, or if you like, rectangle, they need each other, but there's no space for them. There's a lot of policy conversation that is going on, but it's excluded for only policy people. Then clinicians also have their platforms. So they are professional associations. And when they meet alone and they have their own conversations and they lament about DHIS2 and all of those digital platforms, and no solution comes up. Then there's also the end user who sits somewhere the platform comes, they jump on it, it's not interactive, they leave, they never go back there. And so if you are interested in this angle of policy work, I think it starts mainly by really good analysis of the situation, because you need to be able to market this angle very well to the two or the three or all of those parties. And the policy issues are very context specific. And so you are not able to go and take the most relevant policy issues in America and bring them to Nigeria or Ghana and implement them. So to start that conversation well, you need to be a really good analyst of what is happening. But you don't need to go and learn policy analysis to be a good analyst. Esine has already mentioned there's a huge conversation about digital skills. It is a policy issue. It impacts the clinician, it impacts the recipient of the services. The policymakers also want digital health to thrive, but they haven't solved it. So if you're able to write a paper like she's proposing, that you want to write a policy paper that sheds more light on this issue, or you want to organize a webinar, or you want to do a policy courtesy call to a policymaker, all you need is to understand the situation. And you have to understand it really well that you can foster a conversation. Sometimes you don't need to be an expert in digital skills. But if you map out the challenge well and you bring all of the stakeholders together on the table, the conversation will thrive and everybody will find their way out. So for me, the first step is to do a really good analysis of the issue. And if you want to enter the policy conversation, you need to be a good policy analyst. And I can even move on from the digital skills and the DHIS2 that we mentioned through to talk about an issue very important as data governance. So there's this issue that we found out. There are innovators that are bringing out tech solutions. When they bring out the tech solutions, they thrive in their countries. But a tech solution relies cross-border functionality to be able to work well. If you want to thrive well, you can't just be a champion in Ghana. The population is not enough. You should cross border to Nigeria, who are our brothers and sisters, and tell them that this is the app I have developed. It works well. Come use it. Now, what the challenge they face is that when they develop these platforms in their countries, in an attempt to go to another country, there are data and confidentiality issues that the policy framework does not allow. And so when they do cross the border, their apps are either rejected or they are not used. Or if you go and do it, nobody bothers about it. So there's a huge gap of what do we ensure? How do we ensure that we have a continental framework for data governance that allows tech solutions to thrive? Now, forget the policy angle alone. There's also the users. Every user of digital health provides their data. They give you their age, sometimes their status, be it disease or not, or they interact with you and give you confidential information as a tech platform. Now, there's a huge concern in the population about where that data goes and who has access to it. So if there's no solution about data governance, the users don't get in. They can't get in, or they get in and provide you wrong information. And if you are a clinician or a practitioner of health, you know that the foundation for good diagnosis and care is information, is data. If you don't provide that information accurately, nobody can help you. And so that gap exists for the tech people. The policy people are struggling, the users are struggling, the clinicians are struggling, and there's no solution. So if you analyze this situation rightfully, you can enter in there and create awareness or mobilize spaces that people can have a conversation to solve it. So again, the problems vary from context to context. You need, if you want to start a policy conversation, you need a good analysis of the situation, and then you can jump into the conversation phase.
First of all, scope the situation, analysis, find out what the problem really is, and then you can jump in. Thank you for that. And you really covered a lot of things. I mean, each time you talk, like my questions are just going and going and going. I'm running out of things to ask you. So please, if you have questions, Please drop them in the chat and we'll be able to see them. If you have any questions for us, you can please leave them in the chat. And we can see the questions. So while we wait, you've talked a lot about, I mean, the silos, the issues facing digital health continentally. But let's talk about solutions. How do you think you've talked about some challenges facing digital health today in Africa? If you want to add some more to that, definitely. But how can professionals in this space overcome them? I mean, using African solutions, because I'm a proponent of African solutions to African problems. So, how can professionals in Africa overcome these challenges facing digital health in Africa?
Yeah, thank you very much. I think, like you said, I'm also a Pan Africanist like you. And beyond being a Pan Africanist and supporting African solutions, if you are a policy or programs person, you understand that solutions are not universal. You can't adapt, just pick a solution from elsewhere and bring it. And that's what we've attempted to do so many times in Africa in the past, where we just copy blindly, but the context varies so much that it either works minimal or it doesn't work at all. So we need to find African solutions. But these solutions, I think the foundation for me is the people that we have. And these people, majority still are young people. And so for the tech health, digital health uh, uh, solution to arrive, like we did highlight in the past, I am a believer that we need everybody on board. And so we need capable hands to manage it, which means that we cannot continue to produce nurses, doctors, pharmacists, and other providers who cannot manipulate the computer. The computer is the basic now. And in one of the conferences I attended, I made a point that I think in the past centuries, education began from being able to write the A, B, C, D letters and spelling words. I think we need to push for a shift in that perspective so that the beginning of education should now be those who can manipulate the computer and digital platforms. Because a lot of the things we do are now being transitioned to digital platforms. So for me, the solution lies in digital literacy. Digital literacy for the provider, digital literacy for the African population. So that when the provider gets the platform, they can use it. And when the end users and beneficiaries see it, they can understand and they can interact with it. Other than that, the solutions will never come. And for that to be arrived at, and is the reason I do policy work, I'm not saying the other elements are not important, but I feel that we need the policy push. We need to push our policymakers. We need to push them a bit more so that they understand that the best nurse in this era is not just the one with the nursing skills, but the one that can leverage on digital platforms, one, to learn and also to connect with their colleagues and even get better things. So I give an example where uh, the rural urban divide can be breached with that digital divide if we are able to do it. If you have one nurse seated in the most rural area in Nigeria, and there's only one available doctor in Lagos, and that nurse has access to the doctor to confide or to consult them in the decision they take in a critical condition for a patient, there's likelihood that that patient will survive. But if that nurse has to rely on their own intuition or instinct, they may likely not be adequate. So there's that gap that if we don't drive the tech solutions to rely on human skills, where we want to ensure that every human being has the capacity to use the skills or the tech platforms, then the solutions will never come. You can design all the apps you want, you can put all the policies you want in place, create the enabling environment, the users will not be reached. So we need that solution. And the foundation of it can be policy, but at the end, we want our digital health practitioners or our health practitioners to be digital literates, and we want our population to be digital literate so that we can reach them.
Beautiful. And I'm going to do a shameless plug here. This is what we do in Digital Health Skills for Africa is building capacity of healthcare professionals in digital health methodologies, principles, and tools. And we have a cohort that is coming up soon. And for those who have applied, you're going to, if you're successful, you're going to get an email soon. And let's get back to our program, just for me to mention that. So we've talked about the past, we're talking about the current, and so let's talk about the future. What does the future of digital health in Africa look like to you? What do you hope for to see in the future, and what role do you hope to play in shaping it?
Yeah. So I think Africa is one continent that cannot be underrated. And I usually say that because I have had a huge privilege of interacting with African youth across
Yeah.
the continent. And I think that you can never underrate the agency of the African youth. And for me, that is the future. The future is that there are people who have jumped on this webinar to use their data to watch us, listen to us, whilst they have needs that are not met in their life. But they will sacrifice their resources to buy data and watch this clip because they think that they want to own their own future and learn on their own and survive. And so the African agency you can't underrate. So for me, the future of digital health is in Africa is the people. And the people I'll be biased to say is the youth. Because from TikTok to WhatsApp to YouTube to Facebook, wherever you go, it is the young people that you are going to interact with them more. And these are digital platforms. They could be used for health programming purposes. We are currently using YouTube to talk about digital health skills and what it means for the African people. This is an opportunity that over 80-90% of the people who watch this clip will be young people. And so I believe the future is the youth. And the role I am hoping to be able to play in this whole situation is that, like you at Digital Health Skills for Africa, I think that I need to be more vibrant in engaging policymakers to help them understand that the young people are ready and waiting to be taught. They are ready and waiting to learn, and they are ready and waiting to interact with the digital sphere. And so provide them with the opportunity and skills they need. I'm also hoping to be able to reach as many young people as possible, but most importantly, because I believe that context matters, I believe, like the work we are doing at Transform Health and Yet for Age, we need to bring young people from the different experiences to the table so that they can tell their story, they can advocate, and they can engage so that the spaces will open a bit further. For instance, I'm unable to speak on behalf of tech solution or tech experts who are youth. And young people have different categories. There are us, the policy engagement people, there's the practitioners, but they are the tech based people who are bringing the solutions. And whether we like it or not, young people are those innovators. And so they are still the future of digital health. If we don't create an environment that allows their solutions to thrive, then we can never get the solution. So I hope that I play a good role in this. But at the end, I hope that the African youth in the next 10 years are better placed to innovate, but also to use the innovations that are produced.
That's amazing, and then that's what I also pray for. Like that's the future I also look forward to. And talking about these African youths and those coming up, we have talked about the lack of digital health training in our curriculum, which means that people are coming out of the universities not prepared enough for a career in digital health. We don't have a clear pathway. We don't have universities offering courses. We have very few universities that even offer postgraduate courses in digital health. So, what advice will you give someone starting out their career or who wants to have a career in digital health, especially for those who are feeling very overwhelmed? Yeah, there's a lot of information, there are webinars, there are all sorts of things out there, but you still get this question of what exactly should I do? Like step by step, what can I do to get to where you are, Caesar? I want to be where you are. I want to do the things you do. What should I do?
I think for me, anybody who sees this video is already doing the right thing. That's the first one. Anybody who watches this video live stream or the end product is already doing the right thing, because I think the beginning is to know that you need to do something. You need to learn more about digital health. But the second step, most crucial for me, is that leverage on your skills. So a lot of the time, and it's not just in digital health, we allow people to define terms for us. So people define the terms of engagement and we try to engage. You can't survive in that battle. It's not, it's even in football, which is a game, and if you like hockey and all of those games, the rules are defined fairly for everybody. So if you allow one area angle to define the terms, then you will struggle. So I say leverage on your strength. And let me provide an example. If you're a researcher and you say that you want to engage in digital health, you cannot start from where Enzine started. If you start there, you fail because she didn't enter the digital health space from the research background. She started as a pharmacist and she leveraged on her pharmacist skills and knowledge to thrive. And she understood that her colleagues needed digital health skills. And so she's in the space to ensure that it happens. Researchers in Africa need knowledge on digital health to understand how to research better into it. At Yet for Age, we started a program called a Youth Research Fellowship to help young people understand how what are the key issues that you can research into as a researcher so that you will be relevant for the digital health space. So if you're a researcher, that is your strength. Just enter the space with your digital health research skills and you will thrive. If you are, let's say, a financing person, you do um, uh, proposal development, business development, and all of those things. You do not need to come and start from a clinical perspective. So, in the end, the only advice I think I can give from my experience is, and just like Enzine also said, transitioning from clinical background to public health was one step. Now, when you learn public health programming, you can easily enter the digital health space. That is a long journey. But if you want to engage from the digital, the innovator perspective, possibly you can create apps. All you need is a friend who is a clinical person to tell you where a problem is. And then you can innovate to solve that problem. But you can't enter the conversation again as a clinician. So leverage on your strength, leverage on your skills, and it will all the digital health space is too large for all of us. And so from each of these angles, you can find space. And if you now enter and you need certain skills like policy analysis, digital literacy, if you need things like understanding the clinical perspective or policy engagement, you can learn. But first of all, you must find an entry point. And the entry point is what you are sitting on, it's your skill, it's your experience. You can also enter. I've met people in the digital health space who have entered the digital health space from their user perspective because they are not tech people, they are not policy people. All they want is to be loud that they have used multiple platforms. If we have somebody on this call or this video who has used 10 applications, digital health applications in Nigeria, and the person can take the pain of documenting their experience using those 10 applications. I tell you, in 2 years, 3 years' time, you will find yourself in the next big conference because there are people waiting to hear the story of users so that they can better create applications for them. So again, not to repeat and not to say anything, leverage on your strength.
Beautiful. And then leverage on your strength and collaborations as well, because apps, everybody's developing apps. Please, let's collaborate. Let there be collaboration as we're leveraging our strengths. And to just add to that, it also helps. I mean, most of us see this from, I'm a clinician, I want to get into digital health, but they also have people who are very techie and they want to also get into digital health. So it goes both ways, and they just need to add some clinical expertise or clinical um, learning to it to get to that point. So there should be a marriage between you being a clinician and you being a very techie person to be able to get that middle ground of digital health. And that's how we create apps and solutions that have beautiful, not just beautiful UIs, but also great UX, so that we have that great interface, but also a beautiful user experience, so that we don't just have beautiful apps, but then, like you said, patient experience becomes neglected. So, and also patients, please, it's not just us who are producing. There are conferences now that I'm going to, I'm part of, are beginning to have people who are patients being invited to talk about their experience, because we want to hear, we want to know if what we're doing is right. Are we really making an impact? Are we making it worse? With the whole AI propaganda, AI this, AI that, AI is curing diseases, AI is helping us do this and AI do that. Are we even making things better for the end users? Are these apps patients? Is it patients? The is it the use design patient centered and all those questions. So this is a very insightful conversation and feedback that you gave. And so as we're wrapping up now, I just want to know, this is a very interesting question. If you could go back in time, what is one thing you would do differently in your career, if any?
Uh, First of all, like we always say, as you go, looking back is important. But if I could do something differently, it will be to learn for the future. I think in Africa, and maybe we are the only continent, but maybe the others struggling like us, but we are experts in learning the past, the theories. So we learn so much and we give people so much information about the past, how it used to happen. And so if you go to the African clinical experience, maybe teaching, they will still be using mercury thermometer to train a nurse. When the digital thermometer is there and accurate and is being used, and they will still use a BP apparatus that is very manual when there's a digital one that can make your life easy. So I'm just saying that we are experts in learning the past. If I could go back in time, what I would do is to try. There's this concept I learned, and I encourage all of you, the viewers, to maybe research on it. There's this concept I learned recently called strategic foresighting, that the people who do well, if you want, just go Google and learn more about it. The people who actually lead are people who are ahead of time. And if you want to be more impactful, then you must be ahead of time. We are having a conversation in Africa about AI every day, but we are rather complaining of what AI is doing negatively and not the one that is doing positively. So, for instance, in African education, you can't use a phone in high school when the phone is now everything. And so there are so many restrictions. So if you want to do well, and I feel if I had the benefit of this experience, I will try to project what will be happening in the next 10 years and begin to learn for it. And so, if you're a health practitioner, if you are an innovator, if you're a patient, or if you're a young person, begin to ask yourself in the next 10 years, what is likely to happen? And there are so many videos you can even find on YouTube about 10 years from now. How will the world look like? You can go watch some of those videos and then you can begin to prepare yourself for that space. Because 10 years from now, if you do not have digital skills, you will be replaced. People say the digital platforms will replace people. No, the digital platforms are not coming to replace people. The people who cannot use the platforms will be replaced by the ones who can use them. And so, if you want to survive in the next 10 years, when you are a little older, begin to learn what will be relevant in the next 10 years. And what is relevant in the next 10 years is AI, is digital platforms, whether for health, for agri, for anything. You need to get ready and you need to get into this space.
Yeah, thank you so much. The couple of things I've picked up today in this our conversation is leveraging on your skills, and I like this strategic foresight. I'm going to look into it. This is my first time hearing it, and looking at digital literacy both on the provider uh, part and the population part. A lot of gems today. It's been really amazing having this conversation with you, and want to thank you for giving us this audience. It's been very insightful, and I want to say thank you to all those who have joined us for this 46-ish minutes of amazing conversation. And so this is saying thank you and have a nice morning, afternoon, and evening to everybody. And to you, Mr. Caesar, thank you for honoring this invitation. And I hope to have you sometime soon uh, on this live events. And anytime we also call you again. So everybody, oh, any words for us, Mr. Caesar? Final words?
No, I think thank you very much for the opportunity. For those of us who have decided to do digital health and it's not being done, these kinds of platforms are also opportunities for us because we are like evangelists. We want to reach as many people as possible. So thank you to everybody who has been able to watch. Look into the space. You can follow me on any of the platforms. You can follow Transform Health, Yet for Age. You can, as an African, there's the African Youth Network for Digital Health that we are setting up by the African CDC. Go look out for them. There are opportunities there for you to learn more and improve your skills. I think the best improvement you can give yourself is to remain in touch with everybody else who is doing the same thing. Because at the end of the day, the strategic foresighting we are speaking about, you pick it from what people are doing and the lessons they've learned. And all of those experiences will guide you. So just stay in touch, use the platforms, and let's try to grow together. Thank you very much for your time.
Thank you so much, everybody, and have a nice whatever time it is in your place. See you next 2 months with another amazing guest. And if you can guess who it is, the prize for the person, what we'll have another amazing guest coming your way in the next 2 months. So bye everybody. See ya.